Hello and welcome in today's nursing webinar session. Myself Shanti, and we are going to talk about the optimization of IV line, its patency and the practical tips. As you all know, patient dissatisfaction has been caused by multiple needle pricks due to catheter occlusion and multiple factors. So let us discuss what we have in today's session. And I welcome Dr. P. Swati Garu, who is our consultant microbiologist and infection control officer from Hitec City, Yashoda Hospital. I welcome you, ma'am.
Thank you, Shanti.
And also, as a speaker, I welcome Ms. Fabina Fernandez, who is our senior nurse manager from HICP department, Yashoda Hospitals. Welcome you, Fabina.
Good afternoon, ma'am. Good afternoon, Dr. Shanti.
Yes, and let us see what we have in today's session. As Dr. Swati, the first question I would like to ask is, like, now if we are looking at the slide, it is like about increased patient dissatisfaction in the healthcare scenario, and because of the multiple pricks, and which also cause a negative impact. So how is the trend of Venflon or needle pricks due to catheter occlusion in the current scenario? Or is it presence of competent staff and the hands-on training is effective nowadays? So your insight about it.
Yes. Venflon pricks are one of, you can say, we can take it as a patient satisfaction index. So that is where that's a very common thing nursing does. And definitely with proper training and, continuous training, hands-on training, that number of pricks or the patency checks can be, if you can train the nurses better on that, obviously the patient satisfaction ratio will go up, is what I feel. And regular trainings will surely add to this.
So let us see what we have in the rest of session. Fabina, you can take over. Yeah.
So first thing, good afternoon, one and all. Let's understand what is intravenous catheter. It's a device medically used to deliver the fluids, the medications, blood products, like our WBCs, directly to the patients through the bloodstream of the patient. So to optimize the patency, let's see what patency refers to what? It is the state of an unobstructed and open flow of the IV cannula for the free flow of the fluids.
So as we are talking about the patency here, again, we would like to understand from you, ma'am, what steps should nurses take daily to check for IV line patency in their patients, because they may forget on their, in daily routine activities. So what is your insight?
So I feel nurses should flush they should have this practice of checking or flushing the line with saline or hep flush at every shift. As the shift changes, they should make it a practice to do that. And they should check for proper flow. As they give the flush, they can check for a proper flow. If there is any obstruction, then they should not push it further. Just wait and see why the obstruction is happening. And inspect for any signs of complication, like any redness is there, swelling is there, etc. These steps would surely help the nurse better. That I feel they should be implemented.
Yes, ma'am. Thank you, ma'am. So understanding the importance of the IV line patency, it will help us to deliver the effective delivery of medications and fluids to the patients. Let's see what are the factors affecting the IV line patency. The factors affecting the IV line patency could be the increased viscosity of the fluids and medications, like when you give TPN, fluids contrasts, and the hypotonic fluids. The size of the catheter also affects the patency, where there is a bigger vein and smaller catheter size. The long usage of the IV catheters, the catheter movement where there are disoriented patients and irritable patients, and the more important one would be when the line is not flushed.
So here again, if patients are, sometimes we get to see patients on low molecular weight heparin, and is this a common myth that when the patients are on these medications, is a risk of bleeding is high, obviously, and should the nurses flush or should not they flush the line?
See, whenever patient is on anticoagulant medication and we add hep flush to it, we are giving them more heparin, which will alter their PT-APTT values, and there is a chance of increased risk of bleeding for such patients. So nurses should be literally careful on what is the medication they're trying to choose for flush in such cases. And there is still, so flush is important, but you have to be a little careful for patients who are already on anticoagulant medication, especially the flush you're choosing. Is it saline or heparin based?
So I think they can opt out for saline instead of
Yes,
heparin
they should
flush.
opt out for saline instead of heparin in patients who have risk of bleeding tendencies, like patient having low platelets or already or who are on anticoagulant medication. That's a very common thing. We put stroke patients on anticoagulation. So they should be literally careful with these patients because we are adding heparin to their already medicated heparin.
Yes. Conditions like dengue and all.
Dengue and all, wherever low platelets are there.
Yes.
Yes, ma'am. So when you see the crucial role of the bedside nurses for assessment of an IV line patency, main thing would be the visual observation. The nurses should assess for the patency of the cannula each and every shift by flushing the saline.
Now, this is very important because in the ward, maybe the lines are used, maybe the catheters are not in use because in the IC scenario, it is different. Is it, again, we would like to again understand, is it important to flush the intravenous line every shift?
Yes, it is important to assure because we don't know when the line will be used.
Yes.
So since the patient is admitted, we should make sure the line is patent at any given point of time. So it is important that this practice, what Fabina is projecting here, the nurses should check by all the 3 shifts. I feel it's very important for a hospitalized patient.
Yes.
Yes. So if there is a senior nurse who has come across a blocked IV cannula, the first thing she could do is to communicate to the patient as well as to the relatives of the patient and to convince the patient for the next cannula placement. First thing she could do is to assess the IV site immediately, verify the nature of block, like what kind of block it is, and to attempt the flush cannula try to replace the cannula and document the same thing and hand over and at the same time to monitor again and again.
So I think this is very challengeable and mostly this conditions are being contracted by evening night supervisors during their day shifts and all during their shifts. So these points are very valid. I guess one must troubleshoot, but again, nurses awareness about like if the line is patent, ma'am, and should they change the line? And should we change it to a new one? And how often they should be,
If the line is patent and if there are no signs of any, I knew all nurses use VIP scoring and all. So if you now find no signs of that score where you need to change, I feel you need not change the line. But maximum recommendation according to CDC or any standard guidelines, if you see, a line can be used for say 48 to 96 hours max based on the usage of the line again and what is that line being continuously used for. If you have very high density fluids like blood or mannitol, we don't recommend multiple usage of that line. So it depends on various factors, but that again, as you said, it has to be assessed. Yes. So every line has to be assessed. We can't put everything under one umbrella, but you can see that based on the line, if that it is patent and there are no signs of any change or VIP score is fine, there is no need to change. But if there is a change, you feel it is not patent and there is a signs of little inflammation and all, I feel the line should be changed immediately.
Okay. So looking into what are the practical tips for optimizing the patency of the IV line, it could be a regular flushing, visual assessment like daily handover, and during intershifting of the patients, which can this even can give the nurse the assurance for their timely treatment to be done promptly, catheter selections to be done properly as per the vein and as per the gauge of the catheter, securement of the catheter, especially when there is a subconscious patient or an irritable patient, and changing of the cannula when it is really required.
Yes, you can go forward. Yep.
Yeah, looking into the more practical tips, proper flushing techniques is a very important thing and plays a major role for maintaining the patency. Using a gentle pressure, assessing the patency, use a correct syringe size, like using a 10 ml syringe for flushing rather than 5 and a 2 ml, which adds a more pressure that can damage the catheter.
So again, I think, Swati ma'am here, is it true that a 10 ml syringe, is this fact valid, and would you like to acknowledge the same that it may
Yes, the
cause?
fact is valid because it has been, various studies have been there which demonstrates that 10 ml syringe, because the volume of the syringe is high, it will reduce the risk of excessive pressure on the vein. So I would, this would be a good practice to follow, using of 10 ml syringe for flush.
So sometimes we get to see nurses using 2 ml and 5 ml syringes. So please do not adhere these practices. Only stick to using the 10 ml syringes. Yeah.
Looking into another tip, practical tip could be flushing of peripheral IV lines before and after medication administration. Flush with 2 to 5 ml of NS or heparin flush. Routine maintenance routine maintenance, as well as apart from that, every shift and every 8 to 12 hours if it is not in use.
So when we are talking about the routine maintenance, ma'am, what does routine maintenance of IV line flushing means, and how frequently should flushing be performed in this scenario? Because many hospital has their own practice and policies in place. So we would like to understand from you.
So as we discussed before, if at all we can do for every shift, it's a best practice.
Yeah.
So we have to, that routine maintenance of IV lines should be in place for any hospitalized patient, whether it may be peripheral or central lines.
Yes.
And moreover, whatever is a blood or a medication being left in the tube or in that line will also get, that will prevent the clot formation, especially if there is a blood well, that when you're handling, there is a chance that some blood flows into that small cannula. So if you keep flushing it, the clot will not form. It will not block the IV, the tube or the patent. The line will remain patent. So it is always a good practice, like at least every 8 to 12 hours, line flushing should be done.
So looking into as per the guidelines of VIP.
So here, yes, Fabina, yeah, this is how I think this is the guideline VIP visual infusion phlebitis assessment score, which helps in early detection, prevention of blockages and phlebitis, because here the bedside nurses should understand when to resite cannula. They may be wrong while taking this decision making. That is how this beautiful guidelines they should follow: when to recite, when to remove, when to just observe the signs and symptoms of phlebitis and document. That's how we capture and reduce the reductions of phlebitis in the healthcare scenario. Yes.
Yes, ma'am. So let's look into the dangers and the risk which risk in forcing of the flushing. Catheters and vein can be damaged, making a patient feel really a crucial pain, dislodgement of clots, and then risk of the infections can also rise, which in turn can become an encounter for the resistance of the treatment. Stop and assess. If resistance is felt, stop the flush immediately. That is the best thing anybody can do it. Check for the kinks or clamps in the IV catheter. Try to attempt to gently aspirate the line.
And ma'am, I think you will agree and acknowledge with these points, which we are not supposed to do very strictly. And because this is against the practice of, forcing and flushing the IV line. So what is your take on this?
Yes, what we mentioned here is absolutely right. We cannot force the fluid through it. It's very risky to do it because dislodgement of clots can be very dangerous for some of the patients also. So I strongly agree that you should not force flush anything. And all the 3 steps mentioned here are very important for any nurse to practice whenever she encounters a resistance.
So from the view of as an infection control nurse, the best thing you can do is using a sterile technique and a proper hand hygiene can prevent central catheter-related bloodstream infections.
And I think we have come to the end of the session, and we would like to, request Dr. Swati to just conclude, because we have a lot of viewers in a form of student and learners. So your last conclusion, ma'am.
So I would like to I would like to put forward that IV line is a very important, IV line putting technique is a very important thing all nurses should know. Maintaining it is important because as an infection control person, we know it's a site of entry for any infection. So as you put the line and as you maintain the line, we insist on following the hand hygiene practices. Do not touch a line without any hand hygiene practice. Do your hand hygiene and then touch any access. We recommend scrub the hub wherever possible, especially for central lines. This is a very mandatory technique to follow. Maintain the patency of the line by recommended practices like flushing the line every 8 to 12 hours. And we have to use saline or hep flush judiciously. Wherever patients have low chances of bleeding, please try to avoid hep flush. You can always consult your consultant on what flush to use. And when you're using saline, make sure you don't, you have to use saline for that day. Keep it covered. Don't open a punctured saline, keep it open. And then keep using it again and again and again. As you know, our hospital has a practice of using one bottle or 100 ml bottle open only for 24 hours max. After that, we have to open the new one. So all these practices will always see that our patients are safe. And patient safety lies in most important person who plays major role in patient safety is nursing. So you are the ones who can make the change. So I request all the nurses, make this a note of all these practices and put it in your practice. Thank you.
So, yeah, we have ended this session, and we urge all the nurses, bedside nurses especially, to follow and strictly adhere these practices. I thank Dr. Swati for your valuable time, and thank you, Fabina. We end the session.
Thank you, ma'am.
Thank you.
Thank you.